be able to deal with the problem of the uninsured in a much more targeted way, rather than having a huge and expensive new government program. Mr. Tanner also suggested that the number of the uninsured in America is inflated. Could you please comment about these 2 points? We hear a lot about the validity of the number of the uninsured. Why is it so? And is there any way to insure more Americans without handing this over to the government?
Thank you. I did have the opportunity to read Michael Tanner's piece, and it's a real good article. I think you can find it at the Cato Institute's website for those of you who are interested in looking at it. It's a real nice piece. I think the main point of Michael Tanner's article was not so much in terms of the number of uninsured, but more along the lines of what it means to be uninsured in America. Because I think there is a popular misconception among many people that to be uninsured means that you are completely without health care. One example of how this is not true is, for example, EMTALA legislation, which requires every hospital that receives Medicare funds in the United States to provide care, emergency care, for every single person who comes to the door. That applies no matter what their status is, no matter what their ability to pay is, and it also applies no matter what their citizenship status is. So I think that's one of the things that Tanner pointed out. The other thing that he pointed out is that there's a misconception that if you're uninsured, it automatically means that you lack the means to afford insurance. And if you look at the statistics show that a good number of people who are uninsured because they chose not to buy insurance, though they had insurance available to them through employers, and though they had the money to afford that insurance. There's another, in the calculations that they have, I think the number that Tanner suggests is 47 million uninsured people. In that number, 10 million of those people that are calculated are illegal aliens. So that drives the number up. Another 12 million of the people, nearly a quarter of the people referred to in that number that keeps being thrown around, are people who are covered by Medicaid, including many children who have access to the S-CHIP program and other means to receive care. So I really think that the main point that Tanner makes, and it's a credible point, is that we need to really look closely to see who we are talking about. Make no mistake about it. If you are uninsured and you have a catastrophic illness, it will impact you, and that is something that we need to address. I think the biggest issue is how we go about addressing that. And he offered a number of suggestions, and I think the best one that was in there, actually there were two. One is that we stop rating our insurance plans on a community basis, so that if I'm a young and healthy person who has made great lifestyle choices, I'm paying the same rate as someone who hasn't, who is at greater risk. It should be adjusted to the individual rather than in group plans, and I think Ryan could probably talk about this better than me. You're rating everybody together. The second thing is that right now, if you buy insurance through your employer, that is pre-tax dollars. So there's a substantial tax incentive to buy through your employer. However, if you were to buy insurance on your own, there is no such benefit, and you're using post-tax dollars to achieve that. I think we should look at whether or not we can give a tax break on that.
The question is there a way to insure more Americans without handing this over to government? Let me whip off at least a half a dozen. Allow the creation of association health plans. This will allow small employers to come together and form large purchasing pools, such as labor unions and large corporations. You can join through a Grange or your Farm Bureau or National Federation of Independent Business, even through your organization, if it's been around for at least 3 years and shown it can be responsible. That will greatly enlarge the number of insured. It will do away with pre-existing illnesses as a bar to insurance, and will bring down the cost of health and accident insurance. Second, expand tax-free availability to health savings accounts. How many here have HSAs? Good number here. Those will be eliminated if this bill is put into effect. 3, expand small business tax deductions for health care expenses. Mom and pops are not allowed to buy health insurance with pre-tax payroll, with pre-payroll tax dollars. If they were allowed to, that'd bring down the cost of health insurance by 15.6% off the top. Create refundable tax credits to help low-income Americans purchase health insurance. Many people should be given the option to pay income tax or buy health insurance. It simply makes sense. That way the government's not directly involved. Preserve the high-quality care of America for America's community health clinics. Crusader Clinic in Rockford last year saw 46,000 people. They deliver 1 out of 4 babies, and have one of the it's one of the highest rated clinics in the country. 5, reforming our out-of-control medical liability system. There's not one word in this bill about tort reform. Nothing to bring down the high cost of medical liability insurance for the Americans. Create incentives to save now for future long-term health care needs. Create a high-risk pool for those who are maxing out on their $1 million caps on health insurance. These are not hard to enact. Twice the House passed association health plans, and it missed a vote in the Senate, missed it by 2 votes, and therefore it failed. Twice the House passed reasonable medical liability insurance. Each time the Senate did not bring it up. That's because you need 60 votes in the Senate in order to move the bill.
Thank you, Representative. Go to the next question. Our next question is for Lincoln. One issue at the center of this debate is rationing. It's clear that Americans just don't like the sound of it and categorically reject